All right, well, let's go ahead and get started. I know we have a lot to cover today. Welcome, everybody. Thanks for joining us today on I guess we could call this our first Capital Chat after session for 2024. I'm Brooke Lovelace. I'm the Executive Director of the DD Council, and we're glad you're here. Just some housekeeping things. We do have closed captioning, and they've changed Zoom around a little bit. To get to it, you might have to hit the three dots, the more button, to get the closed captioning going. And we do have the chat function going, so you can put questions and comments in the chat, and we will be monitoring that. Appreciate you guys joining today. And I think we even have some legislators with us. I think I saw Representative Bergen is on with us today. So thanks for joining us. That was the only one I saw so far, but thank you for being here. And I think I'm going to turn it over now to Amy.
All right, can everybody hear me okay? I think so. Well, thanks for joining us. Session ended, if you hadn't heard, on very early morning hours of Saturday, April 20th, 3:26 a.m. to be exact, after they worked pretty much a solid full day in session to pass all of the budgets and their priorities. So ended pretty quickly once things got wrapped up. So now we're in that time period where the governor has 30 days to sign all of the bills that were sent to her. And I counted up that there were 169 bills. Hold on a minute, let me get this moving. 169 bills sent to the governor this year. And that sounds like a lot, but I didn't count up how many bills were introduced, but it was in the thousands. So you can tell, usually it's between 10 and 13% of the bills that are introduced each year get sent to the governor. The governor has two choices mainly. One is to sign the bill into law, which she's done. About half of those have been signed into law already. The other option is to veto it, meaning it will not go into law. On budgets, she has a third option where she can take out and veto parts of the budget, but not the full bill. So she can take out one appropriation for something or some language. She can pick and choose which pieces she wants to sign into law. Usually doesn't do a lot of that, though. So we still have about half the bills waiting for a signature, and she'll have to do that in the next 30 days. I wanted to show you a couple that have already been signed into law. We've talked about these a lot in prior capital chats, but one of them I don't think we have, and I wanted to just point out a couple of things. The guardianship and conservatorship changes. Many of you are aware of all of those pretty extensively because that bill was around, we started working on it pre-pandemic, and it finally was passed into law earlier this year. So Senate File 295. And I know a lot of you know some of the advocates that worked on that, including Bill and Kyle Stumpf, who from the Dubuque area worked very hard about that. I think Bill must have a house now in Des Moines as much as he had to come in for subcommittee meetings and on his own dime. So that's a real committed advocate. The other bill we talked about, and both of these were our bills of the week. I kind of highlighted those. So if you want to go back and take a look at what those do more in depth, you can go to our bill of the week section on the website, which is down in the bottom corner, to see all of those bills of the week. They give you a little bit bigger explanation and kind of the impacts on people with disabilities. But that bill, House File 2232, was introduced by, was it Amazon, Carlin? Yeah. I get my big tech confused, but Amazon hires a lot of individuals who are deaf or have hearing issues, and they often hire sign language interpreters that they want to be able to use across all of their stores. So getting licensing each person in each state is difficult. So this bill allows an employer to get a license for all of their interpreters so that they can do like worker to worker interpretation. So not communicating with the public, but communicating internally in on the workplace. So that bill was also signed into law. I won't talk a lot about the AEA reform because we spent at least two, if not all three of our previous capital chats on that. And we can certainly talk more about that in detail, but we will be following the progress of that and being very engaged and talking about how you can be engaged in moving forward with the changes that happened. House File 2404, we hadn't really talked a lot about. It is the Department of Health and Human Services big bill. They call it an omnibus, which is basically a legislative term for throwing a bunch of miscellaneous things into a single bill. So it was the department's bill, and it did a few things. It changed mandatory reporting training for dependent adult abuse and child abuse. Instead of saying you have to take a minimum of 2 hours a year, it would be required to do a core training course. So instead of hours based, it would be based on a core training course. And then it also expanded the definition of dependent adult abuse to include theft, undue influence, harassment, and deception. And it also extended this to tribal courts. So if there were cases involving Native American individuals, those could be tried there as well. It also, I would say, legalized the healthcare coordination and intervention teams that HHS has been using when they pull all of the people together around an individual to try to find out somebody who needs urgent placement, to try to figure out what can be done to help that individual. And so they pull in, mental health professionals, substance use professionals, the providers, whoever is involved in that person's case, to try to find a better, try to find appropriate placement for them. My screen just went out, so I apologize. It's been doing this. Hopefully you're still hearing me. Are you still there?
We hear you.
Okay. Yeah, if I kick my cord underneath my desk, my cord gets disconnected and then my screen goes out. So I'll try not to move anymore. But those that we kind of wanted to highlight that bill because there were some significant things in there. HHS has already been doing these coordination teams. This just adds, it makes that a process in code. So there are some, I categorize this as good news and mixed news. I don't necessarily think there was bad news, but mixed news. One of the interesting bills that came out this year that I don't think any of us expected was making state parks more accessible to Iowans with disabilities and older Iowans. And that bill passed. But what was really exciting is at the very end, when the budgets were being done in the last week, there was additional funding added. So about $1.3 million was added in two different budgets to help the Department of Natural Resources pay for making parks and recreation areas more accessible. So that goes from just being, the bill said, take a look at how you can make them more accessible, and this actually gives them the money to do it. So we do think that's good news. And we had the bill's sponsor in our snapshot on week 5, and we also did a bill of the week on that. So if you're interested in those. Also, Iowans, this bill has, I always hear this term, long time coming. Legislators like to say this bill's a long time coming. This bill really is a long time coming because House File 626 is the non-medical switching bill, which I think has been around for a decade. The Epilepsy Foundation worked on that and had garnered additional supporters, but they were the lead. And that makes sure that Iowans who are stable on their medication will no longer have to fight with their insurance companies who might want to switch them to a cheaper or generic drug. So if your doctor says you should stay on it and you're stable on the medicine, an insurance company can't force you to switch. So they call that non-medical switching. That bill passed and is on the way to the governor as well. Another one, we always talk about the Iowa Able account or IABLE accounts. Those are where individuals can contribute up to a certain amount tax-free, and then any additional amounts you can still contribute to them, but they aren't, you're still taxed on that income, on those monies. Currently you can put in $2,000 and not pay state taxes on that $2,000. So the first $2,000 you put into an Iowa Able account would be tax-free. This bill changed it to $5,500. So it's another incentive to get people to be able to encouraged or incentive to contribute to these. I think Ben had a question there about that. Is that extended to the account owner? I don't know. Brooke, do you know, or Carlin?
It's not. It would be for people who want to gift an amount to the account holder. So they're the ones that can can make a larger gift and take the income tax deduction.
So what is important about this as well, during the discussion that we had, and we'll talk about these bills later when we talk about promising options for next year. This came up during the discussion of expanding the asset limits of the MEPD program, or the Medicaid for Employed Persons with Disabilities, kind of wrapped into the whole work without worry discussion and all of that. Iowa Able accounts are treated like a retirement account or something. So those are usually exempted from the asset limits of those programs. So just something that I think we have to continue to think about as we look at that whole overall discussion. We had a really good discussion about that after the subcommittee in the Senate about that, and how flexible these accounts are to help pay for living expenses, education, other things related to a person's disability that could be helpful in that asset discussion. So just something to squirrel away in our heads. The other thing is, the good news is something didn't pass. So the bill that would have added restrictions to mail-in voting. So if you vote absentee by mail, not the in-person absentee, but when you get a ballot in the mail, there was a bill that would have required all of the ballots to be received by 4:30, close of business the day before the election. Right now, it's the day of the election before the polls close. So if you still had your envelope, you could take it down to your auditor's office on election day and it would still be counted. It added more envelopes to mail-in voting, and auditors would have had to have printed on those envelopes election-specific information, and then the voter would have had to have put their voter ID number on there, or voter verification number. That did not pass this year. Earlier in the year, they changed the effective date so it wouldn't have affected this November. And I think legislators just thought, we can do this. We can hold off and do this in another year. There were some concerns about the additional envelopes because it would have added a lot of costs to county officials to have to do the mailings and the additional printing. So that did not pass, but that was also a bill of the week we featured. Also on the good news on the House the House. It was the House HHS budget, but it was adopted by the Senate too. But HHS budget had some wonderful things in it. $16.5 million was used in previous years to pay provider rates. So they had to replace those one-time dollars. So that is in the bill. They added another $14.5 million to increase home and community-based services provider rates by 5%. This is on top of the last couple of years of increases. Again, it's not inflation, but because inflation is so high, but it is a significant increase. They added at the last minute, we're able to add $1.4 million for residential-based supported community living rates. This is the service that is intended to help bring kids back into the state that aren't being served now because those rates are so low. So the idea is to help start either preventing kids from being placed out of state or bringing them back into the state. There was an additional $1.7 million to open up more intellectual disability waiver slots. That was added at the last bit too. There was some language in there that said that allowed SCL supported community living services to be offered to individuals age 16 and plus, over age 16. Right now it's just adults. So it lowered the age to 16 and included those with brain injuries, which were not included in the Medicaid reimbursement. So that'll help get youth into those services and transition to them faster. And then also include those with brain injuries that had been refused, as I understand it, from providers because they did not have Medicaid reimbursement for that. There was additional provider rates, $3 million for home health providers, $2.1 million for behavioral health provider rates. I don't know where those will be directed. The department will determine that. Almost $300,000 for community mental health centers, psychiatric medical institutions for children got some increases. I know there are many individuals who use physical therapists and occupational therapists in their treatment. And so those are also increased. Medical equipment reimbursements increased. And they did use some of the autism support fund that had not been utilized and to help child serve here. I guess they're throughout the state to expand access to applied behavioral analysis services. So that's the ABA services. And then there is an out-of-state Florida PMIC, psychiatric medical institution for children, who offers very specialized treatment for kids that have complex conditions, including like violent or sexualized behaviors. And they are put in $3 million to help them purchase a building to be able to provide those services in Iowa. I think the significant piece about that is they also waived the requirement to do an RFP, so it would be a single source contract. Some mixed news. You may have read about this in the newspaper, but the renters with service and assistance animals may have some additional hurdles they have to go through in order to sign their rental agreements or get access to rental properties. Our law was really bad before. It was very unclear. It led to kind of what I heard characterized as a Wild West, like landlords would make their own interpretations of the law. It conflicted with federal housing law rules. So this new law states very clearly what the landlord can and cannot require. And that includes you could be required to have an annual, it's not a prescription, but a note from your doctor, as well as have to show that these animals are indeed service or assistance animals. The doctor would have to document why you need that. And the landlord could then refuse if it's going to cause cost too much money to do it, or would pose a threat to others on the property, or would cause excessive damage to the property. So that's one we'll have to watch as it's being implemented. We've talked a lot with, I know Carlin's talked a lot with DRI, Disability Rights Iowa, on it, and whether it indeed does follow federal law. So I think that's all going to be something that we need to watch. There is also a new bill that was regulating consumable hemp, and we really didn't pay a lot of attention to it early on, but as it was moving through the process, changes were made that it looks like it's going to make it illegal for children to use CBD containing products, even if they're not intoxicating. So even if they don't have high levels of THC. There's a lot of concern about that and how it's going to be implemented. A lot of small businesses are concerned that sell the stuff that doesn't have the THC, the stuff that makes you high in them. And, the law was meant to address like the flying kites and the drinks and the other things that have high THC products that are kind of skirting the law because they're made of hemp instead of marijuana. So I have heard that this is going to be challenged almost immediately in the courts. So I'm not sure if it will get a stay, meaning the judge will say, okay, the law is not going to go into effect until we have a time to rule on it. So I would stay tuned on that. But if you do have kids that use CBD products, you might want to know about this law. I know that it's used in kids with seizure disorders, pain disorders. People will use it as a lotion. So, I don't know. I had a massage and had CBD oil on it, and it didn't have THC. So, it is in a lot of products. Other budgets, I wanted to just highlight a few things. There was $1 million extra for recreational trails, which kind of ties into the parks and accessibility there. As you probably have heard, Woodward State Resource Center has all of their heating and air conditioning stuff in their tunnels underneath, and they're crumbling. So they have to do a complete overhaul and replacement. And that's pretty significant. It's almost $30 million over the next 2 years. So they're kind of splitting it up between 2 years. Also $14 million for the paraeducator salaries that were promised during the AEA debate. Didn't make it into the education budget, but they did put it in the final bill of the year's standings budget. Also really exciting, more money for voc rehab. I know all of us have been very wanting to see those dollars increase. They have a great federal match. So this will bring down a lot of extra federal dollars. We've heard a lot about waiting lists for voc rehab and obviously transitions to work. All of that are really big issues with our legislature right now. So $120,000 and $120,007. I don't even know how to say that. Will go a lot further than it looks like there. There was also the $10 million for special education division that were transferred from the AEAs, and the 2.
Amy, sorry, I was trying to let somebody in and I accidentally muted you.
Okay, can you hear me now?
Yes, sorry about that.
Well, I know people like to mute me, but you're the first that did, Emily. They're continuing the cuts to the AEA budget. I counted 22.5 million, but I'm still waiting on the final fiscal analysis to verify that. It also exempted in the education bill, they added 3 different pieces of language that didn't make it through the legislative process. One was they exempted students with an IEP or 504 plan from new chronic absenteeism laws. They put some kind of strict guidelines in on kids that are chronically absent from school, which is more than 10% of the school year. And basically, if you're a truant, you would not be able to open enroll. So if you're kicked out of one school, you can't go to another. But the important part of that was there was a lot of concern about kids that are students that have an IEP or 504 that might miss a lot of school due to medical or treatment visits, or because of their condition, make it difficult to sometimes go to school. They would be exempted from those sort of escalating penalties for chronic absenteeism. And that's just something that's come up since post-pandemic. It's gotten really bad in some school districts. Their kids are just not going to school. It also prohibits state universities from having diversity, equity, and inclusion offices, which is the DEI that you hear, staff or policies. And they can't spend any money, not even private funds, on those offices. I think we wanted to point that out because disabilities is a part of the DEI mission and work. However, in the language in the bills, they did specifically state based on race, color, sex, or ethnicity. So they left out disability. So when they say you can't treat people differently. So that was one of the things like Representative Turek brought up during debate was, does that mean you can't, if you offer a person with a disability accommodation, you have to offer it to everyone in the school district? So that was their way, I think, of confining that piece. But we'll, again, have to watch how that plays out. It also extended the Iowa Dyslexia Board for 2 more years. It was set to end in 2025, and they extended it to 2027. So Kay asked, I think that's the first question I see. Does Senate File 2435 exempt all students with IEP and 504 plans? That's how I read it. We'll have to see how the rules are implemented on that, but that's what it says if the child has a 50 IEP or 504 plan. And it doesn't say if it's a reason contained in the IEP or 504 plan, it just blanket says. So my daughter has a 504 plan, she would be exempted, as I read it.
Yeah, I just think that I think that's probably an oversight because there's plenty of students with 504 and even IEP plans that don't have chronic health things, that don't have lots of reasons that you named for missing school. I would hope that it maybe in the rulemaking they specify criteria for that.
Yeah, and I would assume there's, even though I think we're still technically on a rule, we're not writing a lot of rules. I think that the whole AEA thing is going to have everything contained with that. And this kind of goes into the AEA stuff too, because there were some kids that I know had issues with truancy and when they had an IEP plan. And so, yeah. I don't know the impact of it on higher education at this point. Carlin, do you have more thoughts on that?
I typed the wrong number there. I was wondering about the DEI, that impact on.
Yeah, that's the same number too. So it's the same.
Okay.
It's the same bill. Yeah. I don't know. I think they rewrote it after the concerns about the disability stuff. So I think the intent was not to impact individuals and accommodations that they make for somebody that has a disability versus treating somebody who is of a certain ethnicity or racial makeup. I think that's more of what it was going after. I just heard on NPR this morning that the how UNI is handling that. It was pretty interesting that they're instead diverting the $300,000 they had for their DEI office to student organizations that represent those populations to help them support the other students. So more like supporting student organizations versus having their own program there or support training them to be able to do that work. So yeah, we'll have to watch how that is. But I think my understanding is universities are have already started to kind of think about how they would do things differently. Lots of mixed news, right? So we had the boards and commissions bill pass. It was not as it looked like when the governor and her review committee recommended it. So it's somewhere kind of in the middle. The House originally had very little, they had a lot of changes, but they were not controversial. I don't think there was anything controversial in the House version. The Senate was closer to what the governor had requested, and what we ended up with was somewhere in the middle, which you would expect with compromise. There is going to be an ongoing for every 4-year review of every board and commission. If you wanted to be on the HHS council, now's the time to do it. They're going to pay them $10,000 a year for their service, and it moves to advisory. So, okay. Requires all boards and commissions to have an option. If you can't drive into Des Moines to have the meeting, you should be able to do it hybrid, either hybrid, some people in town, some people online, or all virtual. Allows boards and commissions to meet as they are needed. So some have a schedule of like quarterly meetings or monthly meetings. This is going to take those out of code and allow them to do that according to as needed. This is pretty controversial, merging the boards of psychology, behavioral health, and social work, but each were able to retain an advisory committee underneath. So hopefully those professions will then have those expertise levels in that area. They merged the dual party relay council and commission for deaf services. I think the Commission for Deaf Services was the only one left from the human rights commissions that stayed in place. They eliminated the Commission on the Status of Persons with Disabilities, which was in that same office. And there was a Commission on the Status of Women, Native Americans, Asian Pacific Islanders, special population groups. It adds a new special education council, and that has parents of children with various disabilities on it. I'll come back to that in a second. It also reduces the number of board members on a few of those commissions. And then you can see the list of all of those that were eliminated, including the Advisory Council on Brain Injuries, which I might also note in the budget, they kept the money for all of the brain injury programs, but they eliminated the line item. So they eliminated the words that said this goes to the Brain Injury Alliance for these services. Instead, they just gave all the money to the department. The department intends on doing the same thing with those dollars. The money's not gone, but they no longer have it specifically for the Brain Injury Alliance. So I think that is something that is worrying some groups, is since it's not there specifically to them, will the department continue to give them those dollars? But this bill just got rid of the council, the autism council. I think Carlin caught it right away. The rationale for eliminating the autism council is we now have the special education council. But of course, we have adults with autism that are covered under that, not just children. So they're missing a whole population when they eliminated that. So you can see the other ones. There's a whole long list of them that you can find in the bill tracker that has all of them. More mixed news. So we all know the behavioral health bill passed. You can see the deadline here is going to be really fast. So I think you're going to start to see the maps coming out very soon, because if you're going to want to have everybody in place early on, you're going to have to speed things up pretty quickly. But there's a lot of information about the behavioral health districts and what the new administrative services organizations will be doing. There's not a lot of information about what the aging and disability resource centers will be doing and how they're funded and all of that. There's just not that much detail on the ADRC side. So they're taking the MHDS regions, mental health and disability services regions, they're putting the mental health portion into all of this other stuff there. So block grants, gambling addiction, substance use disorders, tobacco prevention, all of that go into one service arena. And then the disability services are going to be merged with aging services into this ADRC model. So you have a lot of focus on the behavioral health side, not much focus on the ADRC side. So I think that's something, again, we have to watch, particularly since they put language in there that says funding will end in 2028. That's because there has never been any funding for the ADRCs to do disability, and they're not quite sure how much of the mental health regional funds are actually being used for that now. So they needed to have time to sort all of that out to figure out how the money separation will happen. According to the HHS, that just gives them a deadline to have to do it by, which is pretty far out. So that's actually nice, since it seems like everything else is so fast. Also, for the first time, brain injury is officially recognized as a disability covered under the system, which it's not been included specifically. It's always been a non-target population. So if you have extra money, you can pay for it. So that is one good thing. So it joins all the other disability. So we'll be watching this. There's going to be a lot of, there's going to be a lot of outreach. That transition plan that you see is due July 1. They are going to have promised public opportunities for feedback on that. So stay tuned this summer for that. There we go. So I'm going to save my breath a little bit and let Carlin talk about some of the promising things that we saw this session that didn't make it through, but surely seem like they're in good position for discussion next year.
Thanks, Amy. I'll give you a little time to catch your breath, and good morning, everyone. And thanks, Amy, for giving me this slide to talk about, because it's kind of talking about hope and some hope for the future and some progress that was made this session. And that was because of advocates coming forward to speak up on many of these bills. So, sometimes, as Amy mentioned in some of the previous legislation that has passed, such as the non-medical switching bill, which has been in the works for many years. Some of these bills on this list have also been in the works for many years. And so progress is slow, and sometimes baby steps are necessary. And that's what it seems like we had this year on most of these bills, although some of them were fairly recent and got some good traction early on. So we're hoping that we'll get to move forward next session on some of these, although it's an election year. And so the composition of the legislatures is going to change no matter what. And we'll have yet to see what the priorities will be of the new legislation, or the new legislature. that will convene in 2025. But just a quick rundown on some of these. The insurance coverage for autism didn't make much headway this year, but we know that there were groups at the Capitol who came to talk about that, and it's definitely still in consideration. I think there's some other things in the works behind that, and that's why that's not moving very quickly. The other thing I want to note before going into detail on each of these is that if you look down the list, all of these bills have a dollar sign with them, which is why that makes it hard for some of them to get much traction. But I'll note one that the floor manager in the House noted that it could save the state money immediately, which is House File 2706, the Complex Rehab Mobility Equipment bill, which would have eliminated the need for a prescription for somebody who has a wheelchair or any mobility or service device that helps them, that's specifically made for them. If it needs to get repaired right now and you use Medicaid, you would have to get a prescription from your doctor and potentially see your doctor before getting it fixed, and that would eliminate that. So that, couple of steps taken out of the picture could actually save Medicaid in the future. That's a direct cost savings. A lot of these other ones have some long-term effects that are sometimes hard to educate about, long-term savings. And that's where our work as advocates comes in, and how to educate lawmakers on how some of these investments now could save money in the future. But also, some of them we should do just because they're the right things to do. The second one here on the list, Comprehensive Post-Secondary Education Transition Scholarships, which is a long title. We've all been working on this for a couple years. It was introduced by Chad Ingalls, who's had a child go through a comprehensive post-secondary education program, and has noted that they're very expensive for people with intellectual and developmental disabilities to be able to attend these programs, and so wanted to have some scholarships put in by the state that would alleviate the hardship of families who are trying to get their students through these programs. It's got a lot of advocacy this year from students who came in to talk about it, parents, the programs that are affected, got through the House, got a little bit of more traction in the Senate, but just didn't make it into the appropriations bill, and did not make it out of the Senate Education Committee. So we'll have more work to do there. It's going to have to start all over again. These are all going to have to start all over again next year. But at least we have some history to work on. We thought seizure safe schools, it's seizure safe training that would be put into schools. It was tagged on as an amendment to another bill. It was on the debate calendar for the last day of session, and it did not get brought up. That would have been passed right on to the governor if it had. That's another one that we know the advocates have been working on for a long time, and that made headway this year. So we know advocacy works. Sometimes it's just much slower than we'd like it to be. The National Federation for the Blind, Iowa chapter worked hard on the accessible prescriptions. It was the first time it was introduced, and that we hope will continue to have traction as we, again, educate on how this is important for people with low vision or who are blind, to make sure that they are taking their prescriptions as prescribed, which could potentially save lives. The Work Without Worry bill and the Medicaid for Employed Persons with Disabilities are both listed here, which are kind of tied together. We know that many of you gave a lot of attention to these two bills this year, because it could have a very beneficial effect on people with disabilities who are working and want to work more or want to earn more money without losing their Medicaid support. And as Amy mentioned earlier, one of the ways to get around some of the limitations on income and assets is to use an ABLE account. Well, I will mention that these issues, as far as asset and income limits for Medicaid and Social Security, are in discussion at the federal level, and there's some federal movement there to look at those asset limits, which have not been changed for a number of years. I'm not going to throw out a number because it would be from deep in my memory. So these are ways that we can still continue to support employment for people with disabilities, to have them live as independently as possible with the supports that they still need. And these two bills would have done that. The House moved them along pretty well this year. It didn't make it again into appropriations. The Senate had a different proposal that was much scaled down. So it's a topic that's out there. There's a lot of discussion. There's a price tag, and so there's some education that we need to do about how this is a better investment. As I mentioned, the bill for repair of wheelchairs 2706 made some really good ground, and we were hopeful that it could have gone through. But again, we have to talk about the investments there and what it could save. And finally, the direct support professionals income tax deductions came up in the end of session. We were hopeful that it was going to be again put into appropriations. It got some good movement, and it's getting some good discussion again because of the workforce shortage. Again, it didn't make it in, and it got cut back a little bit. So if you're a direct support professional, it got amended to say that the first $10,000 of your wages would be income tax free. And that gives people a little bit more support for coming into that profession or staying into those jobs. So again, we know that we had advocates coming in from many groups that we worked with, came to the Capitol, did testimony on lots of these bills while they were in subcommittee, came and talked to their legislators, did a lot of advocacy in their hometowns also with their legislators. And so that's how these bills move along, maybe more slowly than we would like, but do have opportunity to work for their passage in the future. And so with that, Amy, if you want to move on to the next slide, because I think we want to open it up for your feedback to talk about what's important for you. I did want to mention that, we get our priorities for what to work on and for what to help advocates advocate about from you all, from advocates. For those of you who have issues that you want to work on or problems that you want to solve, we want to help. And so we want to hear what your issues are. We want you to let us know what legislation we should be tracking, should be maybe considering for more discussion. What should our priorities be? And for some of the bills, like Amy mentioned, the bill that discussed hemp, like when that first came out, we were like, that's interesting. We weren't really thinking beyond the intoxicating effects of consuming hemp products affecting people who are using it for medical purposes. And so those unintended consequences sometimes are things that need to be brought to our attention. So we'll open it up for in the chat, or if you'd like to discuss any of the bills that we talked about in detail or have questions, we want to hear from you. And also if the advocacy tools that we are bringing forward are also helping you. And Capital Chat is one of those tools. So if there are ways that we can better be helping you or issues that you would like to see discussed? Was there anything in the chat, Amy, that we need to?
I haven't seen anything. I responded to Kay, asked how many waiver slots the $1.7 million would open up. And I remember Joel Fry saying 70 something. I can't remember the exact number though, but I think I will look that up or find out, and we'll include that in our newsletter so that you have that.
And just real quick, do we know the number on the wait list, the ID wait list?
I will look that up.
Okay.
Here, it's on the dashboard. HHS has a really nice new dashboard that has all of their, I should have bookmarked that. I don't know if you have it. I'll put, when I find it, I'll put it in the chat here. Oh, did Ben just do that?
Yeah, that's the dashboard.
You're so good.
Looks like there's over 13,000 people on it.
Yeah, I'm bookmarking this right now.
13,000 people using it right now, not on the waiting list.
Oh, using it? Oh. Waivers.
So ID wait list is going to be
6,800.
Yep.
I'm sorry, Brooke, how many did you say?
A little bit over 6,800.
Okay.
Yeah, you guys might want to, anybody on the chat should probably do what I just did and bookmark that, because it's got so much really good information on it. And it's usually pretty updated, right? Is it quarterly or is it monthly? I can't remember. I think it's quarterly.
I think it's monthly, Amy.
Is it? Okay.
At least the waiting list stuff they update every month.
Okay.
For some reason, it's delayed. I'm just seeing the latest one is December for the wait list, but it was going month by month before that.
Oh, okay.
Yeah, the one I'm looking at actually isn't on the dashboard. It's just the monthly slot and waiting list summary, and that's at 6,800, and that's as of April.
Yeah, it shows the total waiting lists as 21,000. And the total number on the waivers is 25,000. So, about one person waiting for every, of course, those are duplicated. People can be on more than one waiting list. So I think that's part of what they're trying to get to with the changes they're making. Good questions. You can also talk about what you might be interested in having in our future. If you want to have more in-depth information about anything, we could certainly focus on a topic during, the next capital chats.
We do only have 5 minutes until we lose our interpreter. So if you do have some things, you can always shoot any of us an email that you'd like to see us talk about next time. We're always open for new ideas and new things to visit with you guys about.
I skipped ahead. Of course, all of my slides are going to be online on our website, but I did highlight districts that had primaries. So if there's a primary in the district, like Eric Giddens doesn't have a primary in Senate District 38, but there is a Republican primary, a 3-way Republican primary to challenge him. So there are primaries throughout the state. And the primary election is on June 4th. So we just wanted to make sure you had that marked, and because voting in primaries is important. And a lot of times this is where the battle is. In some areas where maybe a Democrat doesn't stand a chance, the real election is the June 4th election, when you're picking who's going to be the Republican candidate or vice versa. So here's some dates to make sure. We talked about this in our March Capitol chat, because it was right after the first day to request a mail-in ballot. But we will all be able to start voting in a couple of weeks if we wanted to early vote on May 15th. But pay close attention to the pre-registration deadline for voter registrations. If you've moved or you haven't registered to vote, or you're a new voter, make sure you get that done. You can still register at the polls, but it takes extra time and you have to bring documents with you. So just wanted to make sure you had those dates in mind. And then I'm going to turn it over to Brooke, who can talk about the next Capitol chats. Oh, you're muted.
Sorry, I was just looking for our iAble. We did just do a webinar on iAble the first part of April, and that recording is on our website. And I'll, if we have time here, I'll put that in the chat so you guys can see the recording of that if you have more questions about the iAble account. So our next Capitol chats, we keep going during the summer. So just because legislation is, the state legislators aren't in session, that still doesn't mean that we can't talk about policy. And so we have two scheduled, May 31st and June 28th. The May 31st one, we are going to focus on voting and why it's important to get your voice out there. And our special guests are going to be advocates that are going to visit with you about that. One of them is a local elected official, Alex Water, that maybe many know, that's out of the Sioux City area, will be one of our guests. Jen Wolf will be one. And then I think we're going to be looking for a couple of other folks that will visit with us about voting. And then we'll have one on the 28th. I'm not sure who our special guests are there, but we will talk a little bit about the primary results. We're also, during the summer, we move in a little bit more to our federal policy advocacy that we can do, since they're not in session here in Iowa. And so we'll have some of that on our agenda too over the summer. And that's also a very good time in the summer for you guys to meet your legislators, meet the candidates who are running, host town halls of yourself, to get your relationships developed with legislators, so we can get on the ground running for next session, which I'm sure Amy doesn't even like to hear those words right now, next session. So do sign up for our May 31st and our June 28th Capitol chats. I think that's it.
Well, and as always, thank you, Donna, for your speed hands.
Everybody stay safe with the storms today. Be weather aware.
Bye.
Bye, everyone.
Thank you. Bye.